Hey cool cats, I'm Mr. RevCycle, here to give you some updates on what we're doing here at National Revenue Cycle.
Hi, my name is Christy Johansson. Today we'll be reviewing CFSE, Claims Connect, NCE, and EDI. So let's start with CFSE.
Let's hear from Diane Kirsch.
For the MFA program, we were tasked with standardizing all regional processes and communications, as well as to automate processes where possible. The consumer financial service experience improvements include the proactive presumptive award to eliminate the uninsured patient needing to ask for financial assistance, the opportunity to assist the patient with other community benefit options, and to help the patient enroll in the healthcare exchange. In addition, communications to our patients will be written at an 8th grade level, the level established for all communications and letters. We are in development now with KP Health Connect, Epic, and our print vendor. We do have a risk. We are still negotiating with Experian, our third-party vendor, for coverage, and FPL, Federal Poverty Level Information, and we continue to negotiate.
The second stream in operational capabilities is pre-service. At pre-service, we're at the very beginning stages, and we've divided it into 3 sort of work streams. There's staffing roles and metrics, looking at which regions have how many financial counselors doing what work. The second one is spreading best practices that we know already exist. So things like kiosks or concierge financial counseling services. And then the third part is looking at longer-term technology plays, things like how to email estimates from kp.org or click-to-chat functionality. All of this is still very much in the planning stage, but we hope to culminate on a July 8th pre-service meeting. So you will be seeing a hold the date for that for those of you who interact in the pre-service space. Now on to Shauna for payment and collections.
Hello everyone, my name is Shauna Camp and I am the Program Manager on the CFSE Payments and Collections Program. CFSE stands for Consumer Finance Services Experience. Moving to slide 2, what you see now on your screen is our high-level vision and broad goals for payments and collections. So firstly, CFSE is a very large KP initiative. Many, if not all of you, have already heard that between 2014 and 2018, the CFSE initiative will dramatically improve our consumers' financial service experiences by optimizing operations and systems, changing policies, and innovating to create a cohesive end-to-end experience for our members and patients who have direct financial relationships with Kaiser Permanente. Next, on slide 3, what you see before you is a synopsis of what our CFSE Payments and Collections workstream entails, and how we are breaking down the work into 3 interrelated scope areas, which will further break down into multiple projects underneath them. These 3 in-scope areas are Member Payment Solutions, Master Patient Account, and Self-Pay Receivables and Balances. Essentially, the projects that fall under the CFSE Payments and Collections program will target scope and deliverables for improvements and 1KP standards for the KP consumer payments and collections experience, directly correlating to services and products a consumer has monetary responsibility to pay for in relation to 3 areas: revenue cycle, pharmacy, and then flexibility to add premiums later should leadership decide to do so. At this time, our Payments and Collections program is in yellow status. Our yellow status drivers are, at this time, technical issues we are experiencing in Member Payment Solutions. We are targeting to have these issues resolved and back to green status by mid-May. Next, on slide 4, you see our high-level roadmap, currently very draft, which illustrates when we are targeting to complete key activities. The CFSE Payments and Collections leadership team, Aaron Bilvato, Robert Venema, Diane Sessi, and Sheila Stevens, are engaging with the regional CFSE leaders as well as other key stakeholders and subject matter experts in the regions to ensure we have alignment on goals and objectives and the assigned resources we need to get the right work done when we need it done for our consumers this year as well as the next few years. So until we've established and baselined plans across all regions, our engagements and efforts will be minimal but value added based on agreed priorities and assigned and designated resources and subject matter experts. Again, we expect to have all resources and subject matter experts identified and assigned by mid-May. So more to come.
Bron, tell them what's up with NCE.
I'm Baron Pelletini. I'm the National Cost Estimation Program Manager on the business side. I'm glad to provide you status on the program. National Cost Estimation is the program that provides estimation for services to our members and via KP Health Connect and KP.org. And we are live for Northwest, Mass, Colorado, and Georgia since April the 2nd. And California and Hawaii are on the program for going live by end of this year. So we are happy that about 2 million members and Kaiser workforce can access the tool via KP Health Connect and KP.org. And we are very happy to continue the program. Thank you very much.
Groovy. Well, let's see if Stacy Donahue has an update for us for EDI.
Hi, I'm Stacey Donahue, and I'll be giving the EDI update.
Hi, we have exciting news. Our Workers' Comp EDI program is wrapping up. We have our Hawaii region going live this Monday, May 4th, and that will close out the program for Workers' Comp. For California, we're working on a KPEG solution with KP Health Connect to bring in 277 status updates. We're in the requirements phase for this project and are aligning closely with the Tapestry program to ensure that we can reuse as much code as possible, especially around the splitter router. And for the Northwest, we are actually working with them to determine if they would like to move forward with the National Health Logic solution with Bank of America for claims and remit processing. Currently, they're working with Health Logic and Wells Fargo, and they should know more this month in May. Hawaii will start later this year or early 2016.
Out of sight. Let's electric slide over here to Claims Connect.
Hi, I'm Kevin Adkins, the National Revenue Cycle Project Manager supporting the Northwest and Colorado regions in their KP Claims Connect implementation. As you can see here from this KP Claims Connect implementation roadmap, the Hawaii region is live, the Northwest region go live is targeted for August 31st, 2015, the Mid-Atlantic states targeted for February 2016, California for a phased go live between April 2016 through October of 2016, and finally the Colorado region targeted for September of 2016. Now, you might have noticed that the Northwest regional implementation date originally targeted for July 6, 2015 has shifted to August 31st, 2015, and this is due to the roughly 40 days behind schedule that the region is experiencing. And in the Northwest, they experienced a delay in exiting SWT testing and entering user acceptance testing. Now, user acceptance testing has started as of mid-April. The Northwest Regional Program is reporting yellow. The Northwest Regional Revenue Cycle and PFS group is reporting green. And this is because their future state workflows are complete, their KP Health Connect build is complete, which includes lessons learned from Hawaii. They've engaged regional trainers to support any additional training that might be needed for the region that's not going to be covered by the national training group. And they've also are preparing to support and provide any staffing support for the implementation. The Mid-Atlantic state and Colorado regions are reporting green, trending steady, as they continue to meet to discuss workflow, UAT, and training needs.
Now what's going on with California KP Claims Connect?
Hi everyone, my name is Ali Ahmed. I'm the Program Manager for the KP Claims Connect project. I wanted to provide you with a brief status update for the program. The status of the program is in yellow currently. We do have some challenges with the early phases of SIT testing and the start of SWIT testing. And UAT actually slated to start for the program in the late part of July, heading into through the end of the year. After UAT, we are talking from a go-live deployment schedule. So there are 3 phases for deployment. The phase 1 of the deployment would be in the second quarter of 2016. The second phase of deployment will be in the second quarter third quarter of 2016, and the last phase would be in the fourth quarter of 2016. Other topics such as retro adjudication, automatic filing order, OCI, the revenue cycle integration and automation around the splitter router for 835 remittance processing and reconciliation. Those topics are currently being discussed with the revenue cycle leadership and PFS and the KP Claims Connect program as well. The business requirements for the program have been completed and signed off, and we are just wrapping up some further clarification and question and answer sessions for the program. Thank you very much. Have a nice day.
Now let's see if Diane Kirsch has any updates for OCI, TPL, and confidential services. I think she does.
Some KPCC updates. Third-party liability SBAR to transition this process to health plan has been completed and forwarded to executives to socialize with regional CFOs. Other coverage. The process to auto-load coverage found via Experian into KP Health Connect is being presented at the May 15th KP Claims Connect Revenue Cycle Decision Meeting. The question to Revenue Cycle is, why can this not be implemented automatically? And finally, confidential services. The decision made that charges will not post to KP Claims Connect until there is a technical solution in place to ensure this information is not passed on an EOB has been made. Additionally, other system assessments will be included to ensure that we do not risk confidential breaches.
What else you got for us, Christy?
Okay, at the end of every status meeting, we're going to have a special trivia question where the first person to email me the correct answer gets a prize. This month's question is related to some of the staffing research we did around pre-service models. Here I have the ratio of financial counselors to DHMO membership, and we looked only at ROC regions, I have to say. If you can tell me which ROC region has the highest ratio and which one has the lowest ratio, which you'll see is about 1 to 500 and 1 to 50,000, you will get the prize. That's it for this month's report. Thanks so much for your support. Please get any feedback to us, and we'll see you next month.